Hello and welcome to Being Well. I'm Forrest Hanson. If you're new to the show, thanks for joining us today. And if you've listened before, welcome back. Today, I'm joined by a very special guest, a child and adolescent psychiatrist who is, I think it's fair to say, one of the world's leading experts on both borderline personality disorder and dialectical behavioral therapy, or DBT, Dr. Blaise Aguirre. Dr. Aguirre is the medical director of 3 East at McLean Hospital, a residential DBT program for adolescents and young adults, and is an assistant professor of psychiatry at Harvard Medical School. He's also the co-author of a number of books, including DBT for Dummies, and the author of I Hate Myself, Overcome Self-Loathing, and Realize Why You're Wrong About You. So Dr. Blaise, thanks for joining me today. How are you doing?
Tremendous. Thank you so much for having me and for bringing awareness to the kinds of conditions that I worry about becoming more and more prevalent in the world today.
I got to ask you about what you just said there. What do you mean about becoming more prevalent?
So earlier this year, I had a young person come in seeking advice and help because she felt a lot of despair. Now, I hear this all the time. I've been doing this for certainly 25 years at McLean. I am actually going to get my wooden chair this year, and but then also we opened 3 East in 2007, so that's 18 years. And typically it would be, I've had a fight with my parents. I didn't get into my top school. I broke up with my boyfriend, with my girlfriend. My friends don't like me. I'm feeling depressed and hopeless. So those were the kinds of narratives that I would hear about before. There's a fascinating new statistic. 58% of new college graduates cannot find a job. They cannot find a job.
Oh, yeah,
The second thing
totally.
is this. The second thing is that this young woman who wanted to be a bank analyst, that's actually not her, what she says. I'm using this kind of an adjacent profession just so that I wouldn't, divulge anything about who she is. She told me that the way that artificial intelligence is infiltrating this space, accountants, computer software engineers, business analysts are going to find it very difficult to find jobs in the near future. And it's very, very unsettling. I see young people coming in very unsettled about what the future brings. They cannot trust their eyes. They cannot trust their politicians. They cannot trust their own minds. And so I worry that without critical thinking skills, more and more young people who will then become older people and then old people are going to suffer.
So in the time that you've been at McLean, which, like you were saying, 25 years now, roughly how many people have moved through your program?
Well, through my specific program, which is the DBT program, I'd say more than 5,000, maybe 5,500.
That's a lot of people.
A lot of people. And these are the people that we work with are typically people with tremendous amounts of despair, suicidality, and self-destructive behaviors, with conditions either having borderline personality disorder or associated with borderline personality disorder.
So of that 5,000-ish people, about what percent had BPD?
I'd say about 80%, 70 to
Okay.
80% of BPD. Mm-hmm.
So 4,000 BPD clients have moved
Mm-hmm.
through your program at this point. So you're pretty knowledgeable about this stuff. I think it's fair to say.
Yeah, no, I think so. And they're my favorite patients, really. Most people who live don't ever think about living, but when you're thinking about dying, you think about living. So that there's a level of introspection that is somewhat unique to my clients with BPD.
Why is suicidality so common with BPD and so closely associated to it?
I've had people who I've known who've had very severe terminal cancers, and they are in severe, severe physical pain. Uh, Pain that very little can help, even, opiates and those kinds of things. And, who've said that they'd rather be dead than experience that kind of physical pain. And I've understood that, but with conditions like borderline personality disorder, the pain that they experience is an emotional pain. And it's an emotional pain so profound that being dead feels better than being alive. And if you think about, I mean, every one of us has had emotionally painful moments in our lives. Maybe it's the death of of a loved one. Maybe it's the loss of a significant job. Maybe it's being accused of something. Maybe it's losing the love of your life. Who knows? And we've experienced emotional pain. Now, imagine that you had to live with that emotional pain for an indefinite amount of time. That kind of severe emotional pain that you think is not going to end um, can lead people to say, I just can't do this anymore. And I don't want to do this anymore. But the problem is that they don't have the skill set to be able to do something other than self destructive behavior, often, which perpetuates the problem of emotional pain.
I have a general outline knowledge of BPD, abandonment fears, a lot of reassurance seeking,
Mm-hmm.
difficulties with emotional regulation. Those are some of the things that come to mind for me. When I just say things like that, kind of list it out, you can understand how, like, oh, that could be hard for somebody, but it's hard to really feel the depth of what you're talking about here.
Mm-hmm.
So, what is it about BPD or emotional instability in general for people that can lead to the kind of severity of pain that you're talking about here?
So I have four kids, and uh, I remember we went walking in the woods up in New Hampshire once, and it turned out that the place was full of poison ivy. And when we got back, two of my kids had, they had an itch and a reaction to it. Um, One had a very bad reaction to it, and then my fourth kid had a terrible, terrible reaction to it. With incredible itching and skin problems and all sorts of things. And he could barely withstand it. So the the so if you think about the emotional centers in a human's brain, there are people who have, you lose your pet and then you just feel really sad, but maybe your pet was your emotional service creature, and your service animal, and you've lost your pet, and then the reaction that you have in your brain is equivalent to a massive allergic reaction. Or maybe if you're in the sun and you get you get a sunburn, that's one thing. But if you get caught in a fire, then you've got third-degree burns all over your body. That's a very, very different kind of reaction. So the kind of emotional painful reaction is an extreme form of emotional pain in the emotional pain centers of the brain, one that is unbearable.
So everybody has some amount of this, to your point. For everyone, if they experience, poison oak, poison ivy or something, that they're going to get some kind of, unless you're, one of the
Exactly.
privileged among us who's immune to that kind of thing, but those people are
Exactly.
few and far between. I have
Right.
fears of abandonment in a general kind of way.
I
Who
do
wants
too.
to be abandoned, right? Yeah,
Not a
totally.
single person. Right.
Yeah.
Exactly.
So there's a universality to this, but clearly there's, like you're saying, this other layer where, for me, if an example that you gave with the book a couple of times was like being invited to, you see a picture of somebody being invited to a friend's party or something like
Hmm.
that, and you have
Hmm.
an emotional reaction because you weren't invited to that same party. For me, I'd be like, ouch.
Yeah.
But there's kind of a ceiling on it. So you're talking about somebody who's kind of going through life to some extent with that ceiling is just open sky. It just goes and
Exactly.
goes and goes. Yeah.
And then what happens is that the abandonment can be real, like, I'm just done with you, and I don't want you to be in my life anymore. I don't want to be in your life anymore. Or it can be imagined. And then the problem is when the person who's perpetually in fear of abandonment experiences abandonment fears, they can then start doing behaviors like begging the person not to leave, sending them multiple texts, messages, showing up at their place of work or their home, in a desperate attempt to not have a person that they think of as critical to their well-being from leaving. And the problem is that those kinds of behaviors often perpetuate the problem. And that is because, when even if you weren't thinking of abandoning the person, so to speak. Being constantly bombarded with messages saying, please don't leave, please don't leave, please don't leave, eventually becomes annoying. And then you say, look, I'm not putting up with this anymore. So, but, back to your earlier point that, yeah, I mean, if we were left by a best friend, I mean, we would all be sad. But there would be a cap on the level of suffering that we would experience.
So we've already named a couple of things here: fear of abandonment, difficulty regulating these kinds of emotions. Are there other characteristics of BPD that just at the beginning you would want to kind of get out here?
Yeah, often people get into very, very intense relationships, very quick relationships based on emotional compatibility. And often, I remember I had one young person who I told them that they couldn't date because they were so dysregulated. And they said, okay, I won't. And then after a certain period of time, they were more regulated. And they said, yeah, I'm starting to date. And I said, okay, I'd love to meet whoever you're dating so that, they should know about BPD and they should know about what kinds of things trigger the person with BPD and what don't and everything. So she said, that's a great idea. So she brought in the person. I thought that they were really fabulous. And she told me, like, this is the person I'm going to marry. And like, we just love each other so much. And then anyway, the next week, I showed up at my clinic and she was there and there was this other young man. And I said, oh, is this a relative? Like, who is this guy? He says, oh, no, no, this is a new guy that I met. This is the most wonderful person. This is the person I'm going to marry. And I said, what happened to the other guy? That was the guy that you were going to marry. So it's sort of, these relationships are intense, they're volatile, and they can be, kind of unpredictable in their nature. And then when they're good, they're the best emotional feeling ever. But when they're bad, it can lead to a lot of emotional pain. There's a difficulty controlling anger. There's an unsteady sense of self or self image that people just like don't quite figure, don't quite know, or can figure out where they fit in, what their job is going to be, who they should be, how they should dress, characteristics that they should have. Then there's suicidality and self destructiveness. So those are some of the more common BPD symptoms.
For the example that you gave with the young person who, romantic partner shows up this week, they're thrilled to be there with that person. Next week, it's a different romantic partner that they're also thrilled to be with. There's some of that maybe not 100% normal for like a 16-year-old, but
Sure.
certainly I remember being in high school. It was pretty normal for relationships to move around somewhat briskly and with a
Absolutely.
certain
Right.
amount of intensity. I'm wondering if the presentation of this changes a bit as people age.
Yeah. So I think that intensity is still there. And maybe there's some they're approached with caution, a little bit more caution, but often they'll say, I fell for the person immediately. I just held
Yeah,
back.
you do hear that. Yeah.
I just held back a little bit because I didn't want to overwhelm the person. Now, I want to get back to an earlier point. Let's just say that you had two identical twin children, 16-year-olds. They're both serial dating, and one of them has BPD and one of them doesn't. How can you tell the difference? And to your point, um, yeah, somebody could be, yeah, I've got a crush on this person and then on that person and everything like that. But they flow through life's waterways without too many problems. The other one is also doing some serial dating, but for the second one, um, they feel that their life depends on it. They feel that the person helps regulate them. They're using it as a form of self validation, as a form of reassurance that they're wanted, that they're desired. And they feel desperate when that person isn't around. So even though, as an external observer, you might actually see um, very similar behaviors, what's going on inside the mind of the person with BPD could be very different from the person who doesn't have BPD.
One of the things I've heard you say that really landed with me was just this idea that when you have an extra sensitive nervous system, call it whatever your sensitivity it is for anybody, but particularly maybe if you're more in that emotional sensitivity territory that tends to come with BPD. And then you get exposed to normal range problematic environments. So life isn't perfect. Most people have some amount of difficulty that comes with life, right? But it's 2 degrees. It's you have accompanying skills, particularly if you were fortunate enough to have great parents, uh, to learn some things along the way that help you then regulate those experiences, right? But again, if you're moving through those spaces like kind of an exposed nerve, they're just going to land on you incredibly intensely. I think the metaphor that I've heard you give is that it's like driving a fast car that doesn't have great brakes. And then so over time, the target becomes building up some of those brakes that then help you learn how to drive that emotionally intense system more skillfully.
And if you don't have those breaks, it's sort of DBT is like the car mechanic shop that says, okay, let's get rid of the old brakes and let's put in some new ones. Or let's teach you how to drive a little bit slower. Or if you're going to drive fast, just do it on highways that aren't very busy. So use the nervous system that you have, the brain that you have, to navigate the world as it is and not as you want it to be, or in a very uncontrolled fashion.
So before we get into the specific skills that come with DBT or ones that you've found really be helpful for people, I'm wondering what drew you to it in general. Like why DBT? There are a lot of different ways to practice.
So I was trained in a very classical way, so by psychoanalysts. They're brilliant, absolutely brilliant people at Boston University. But what was interesting is that uh, often when a patient sort of presented with a certain kind of problem, they would attribute a lot of that problem to very early childhood experiences. And that the idea was that by understanding uh, those experiences, you could then overcome the problem. So
It would just kind of solve your issue. Yeah.
exactly. So for instance, do you speak any Greek?
No,
Do you know why you don't speak Greek?
because I haven't studied Greek.
Right, but why did your parents not teach you any Greek?
Because they're not Greek.
Do you now understand why you don't speak Greek?
Yes.
Okay, but has that taught you how to speak Greek?
Unfortunately, no. I wish it did though. That would be
So
fantastic.
I think that one of the things that happened is that
Yeah,
those
I get you.
traditional psychotherapies taught you in a very profound way why you were the way that you were, but it didn't do anything about changing what
Mm.
needed to change. And so, what I liked about DBT is, first of all, it's this combination of ancient Eastern Buddhist and Zen principles with philosophy of the power of observation, of noticing the moment from with mindfulness, and Western cognitive behavioral therapy that says why you don't speak Greek is not that important if what you want to do is go to Greece and speak some Greek. Now, it's of some interest as to why that happened, but it doesn't actually help you in the present moment. And one of the things that I liked is that I used to do a lot of that other form of psychotherapy where I would listen and understand a person's past. It never changed anything for them. They felt very heard, they felt very understood, but it did not give them the skill set that they needed to get through the problems of their daily lives. And that by actually, teaching the skills or addressing the deficits that they had in addressing life's problems, they actually felt more capable of dealing with the difficulties of life. It's like saying, okay, yeah, I understand very well why you don't speak Greek, but you're going to be living in Greece in 6 months. Let's start teaching you Greek right now.
Yeah, I think this is just a really deep question in the field that maybe you can help me out with a little bit here, Blaise, because I think that for people, in my own experience, because I'm not a clinician, so I can only speak for myself. Um, for people who have some of those skills that you're describing, and maybe in a second we can get into what these skills are that we keep on
Mhm.
alluding to, that kind of coherent narrative formation can be really essential. And like going back in, understanding what's going on. For me, it's been incredibly helpful to get a picture of myself as a kid, the experiences that I had and how they led to the person that I am as an adult. But to your point, I had good, loving parents in a good, loving environment, pretty neurotypical brain, did not have the kind of additional sensitivities that we're talking about. So I had some of those skills that then let me take the learning that I did by going in and doing that kind of narrative process and, take it into my life, apply it, I hope reasonably effectively. And sure, you got to learn more skills over time, but I had a good foundation. But if you don't have that foundation, you can kind of learn abstractly that, you're supposed to get in a rocket ship and fly to the moon, but that doesn't help you learn how to build a rocket. And I think that it's an important question. And there's this kind of like yin yang in the field in general, where you've got some people who really advocate for the more kind of learn about yourself aspects, and you've got some people who advocate for the more skill development aspects. And clearly, both are important, both serve maybe slightly different populations of people. And I could really imagine that with the core population that you're working with, that skills development is just such a big part of it.
Well, and to your point, I mean that there's a certain degree of a certain indulgence in being able to explore your mind. And
100%. Yeah.
if you say, how many of these podcasts have you done? Would you say?
400 some odd, sneaking up on 500, I think. Yeah.
Okay, and how many fights have you gotten into with your guests?
Guess. Well, I do about half of them with my dad, Rick Hanson. He was a clinical psychologist, and occasionally we'll spar. I think that guess maybe three or four, very
Right.
few.
But I mean, I
Yeah.
think, if you kept getting into these terrible fights, and I said, well, it's a reflection of your relationship with your dad, you might say, okay, I appreciate like that insight, but how am I going to stop getting into fights with my guests?
Yeah, I
Because
don't know how to stop getting into fights. Yeah, totally.
I think that there are times when that kind of exploration is wonderful and it's beautiful, but when the person needs better emotional regulation, better interpersonal regulation, better thought regulation in order to survive, in order to just make it through a day, in order to keep their job. That kind of exploration actually does a disservice. So I think, there's a time and place for everything. Are the psychological experiences that you're uh, having, or the life experiences that you're having, so um, egregious and so debilitating that you're not able to function on a day-to-day basis? Or if you are able to function, that there's an accumulation of situations over time that that do begin to interfere with your work life, with your school life, with your relationship life. And so that's the thing. And so I switched from become a very distant focused analyst. By distant focused, I mean distant in your life, to a kind of a much more present moment focused analyst. So I'm analyzing
Hmm.
tiny things that are happening in the here and now. And the other part of it is this, is that the here and now is the moment that you're much more likely to remember than what life was like for you as a 6-year-old.
I would love to get kind of a picture of DBT from you. What does it look like to do a course of DBT? What are the kinds of things that you're doing with your clients?
So my clients come in typically with 4 different sets of deficits. And um, now, let me just describe what I mean by a deficit. If you don't
Yeah.
know how to swim, you've got a swimming deficit because you don't have the skill set. But you might say to me, I do actually know how to swim, so I don't need to learn how to swim. But on the other hand, you might have learned how to swim in a swimming pool or in a placid lake, but you haven't learned to swim in a stormy ocean. So it's possible that your swimming skills, as you have them, aren't actually that useful for you because the conditions in which you swim are very, tempestuous and wavy and powerful. So the kinds of deficits that people come in with, or the kinds of environments, even if they do have the skills, the environments are too powerful, are problems regulating their emotions, problems regulating their relationships, problems tolerating difficult moments and stressful moments, and living in the present moment. They tend to spend a lot of time regretting a past event, focusing, ruminating on a past event, or imagining a future, creating a future in their minds that we don't know. We don't know what's going to happen in the future, so they're not very present. So if you think about those deficits, so they have a hard time regulating their emotions. DBT teaches very specific emotion regulation skills. They have a hard time regulating their relationships. DBT teaches relationship regulation skills. They have a hard time tolerating distress. DBT teaches distress tolerance skills. And they have a hard time staying present. DBT teaches mindfulness. So those are the basic areas of need, areas of deficit, and DBT's mapping on those specific skill sets onto those deficits.
So it's just a really good fit to some extent for the specific challenges that somebody with BPD is facing. And also, I just want to say this really quickly here because I think it's important to mention this. There is a fundamental unfairness to this whole thing for somebody who is experiencing this. What I mean is that my skills don't need to be that good because my system is not that sensitive. And I would describe myself as having a relatively sensitive normal range system, but I'm very much in the normal range. You know, if you're somebody who has a highly sensitive system, you have to develop really, really good skills. And that's kind of unfair. You have to do more work than somebody else would have to do to develop those skills. And I just think it's important to name that as a piece of this. Because I think that it's so easy for, as you write about in your most recent book, for tons of self-criticism, tons of self-hatred for somebody to come in who because you start asking the question, like, was there just am I just broken? For a long time, people thought that BPD was kind of a minimally treatable condition. These days, we know, of course, that that's not true. And there was an enormous, and still is, an enormous amount of stigma around it due to some of the emotional regulation aspects in particular that can be just very challenging for people. So I think it's important to kind of acknowledge that, you got that big, fast car, you need to build really strong brakes, and it's a little unfair that you've got to do that work.
And you know what, though, and at the same time, yeah, sure, you're going to have to spend a lot more time in the mechanic shop. You're going to have to spend a lot more time strengthening those brakes. But you know what? Once you're able to regulate and drive that car, you're going to get to places faster than anybody else. And so, that the emotional system that can cause you a lot of pain is also the emotional system that can benefit you. And it's remarkable the number of clients of mine who've become medical doctors, DBT therapists, and other psychotherapists, as well as artists and actors, actresses, because they're now emotionally sensitive, they're empathic, and they are able to use that skill set for dealing with others. And you'd like to have an emotionally sensitive, empathic caregiver who is also able to regulate themselves.
Are there particular skills or approaches, techniques, however you want to interpret that question, from DBT that you find yourself continually coming back to with people? It's like a club in your bag that you particularly like?
Yeah, there's a couple. There's the skill of mindfulness, of really being present. You cannot wear yesterday's shoes unless you're wearing them today. But I'm saying you cannot eat yesterday's meal. You cannot, any sort of recollection of the past is just a memory in the present moment. And we don't know what the future is going to bring. I mean, if we did, we would have been able to predict wars and famines and viral outbreaks and presidential elections, and we've never been able to do that. And so we aren't very good at predicting. but we can pay attention to the present moment because it's the only moment that we really live in. And this present moment for almost any of us is not so bad. Yes, you might be in a war zone, and it could be pretty terrible. But from the majority of us who are suffering with thoughts about the past and the future, if we think about right now, it's not so bad. So mindfulness is one. Dialectical thinking, and that is many people with BPD have get stuck believing their own thoughts. So they think that they're a terrible person, and then they believe that they are a terrible person because they believe their thought to be true, and they fuse with their thoughts, and as opposed to separate from their thoughts, recognizing that these are just thoughts. The brain has 60 to 80,000 thoughts a day. Most of them are negative and many are repetitive. So it's like, don't get so caught up in believing the content of your thoughts. So there's the skill of opposite action. Opposite action means if you're depressed, we tend to have an action like staying in bed all day. If you're anxious, you might have the action of avoiding certain situations. Opposite, the problem with doing those things repeatedly is you become very good at that. Opposite action is to do the opposite or maybe different action of what your action urge tells you to do. So if you're staying in bed, opposite action would be to get up out of bed. If you're avoiding people, opposite action would be to reach out to people. So there's dialectical thinking again, which is, that people have different points of view, that you don't have to believe everything that you think and that you have a point of view, but then the other person that you're talking with has a point of view that might be different from yours and it's just as valid as yours is. So dialectical thinking, mindfulness, some of the emotion regulation skills like opposite action, some of the interpersonal effectiveness skills.
Sorry for the brief interruption here. Thanks so much for watching my channel. But it's come to my attention that over 60% of the people who are watching this right now are not subscribed. So if you could take a moment and what did they say? Smash that like button, subscribe to the channel, whatever it is. We'd really appreciate it. All right. So thanks a bunch. It's all well and good to tell somebody, and this is why you are who you are and you do the work that you do, because it's easy for me to say, okay, hold in your mind the belief that other people have different thoughts from you, and it's really okay that they have different thoughts from you, and you're having these negative thoughts about yourself, and those thoughts are just like clouds, they just change. You don't buy into them too much. And then somebody you're working with says, all right, that sounds nice. Are you insane? It's a little bit more challenging than that. So I'm wondering how you help somebody start to get some space so that they can apply some of those skills that you're describing, even around that kind of like tightness of believing their own thoughts, for lack of a better way of putting it.
If you think a little bit about, let's go back to the language analogy. I mean, you don't even question why you speak English. You don't wake up in the morning thinking, why do I speak English? It's you have I mean, English and you are probably as fused as can be, unless you speak another
Completely
primary
fused, yeah.
language. It's, and it doesn't get you into any sort of trouble. But if I were to say, where did you learn how to speak English? You'd say from very early on, you know. And the problem for a lot of people who have thoughts that are unhelpful to them is that they've learned those thoughts and amplified those thoughts somewhere along the way. And what I want to know is, where did they learn to start believing that those thoughts were true? And by the way, I mean, it's a little bit like a child believes in Santa Claus, and they believe until 4 or 5 or 6 or 7 or whatever it is, and then eventually people tell you, actually it's not really that true, and it was just a way to tell a nice little fantasy and a fairy tale, and then you get really disappointed, and you move on. But imagine that you lived in an environment where someone perpetuated some narrative that wasn't actually that helpful to you. Stories about who you are as a human being, and then that you're less worthy, that you're not as worthy as, you're less worthy than, that you're not enough, and your world tells you that that happens to be true about you. So you start to fuse those things together. And it's, how did you learn that? Because these are all learned constructs. You aren't born with any of them. You aren't born believing in Santa Claus. You aren't born hating yourself. You aren't born self-critical. You have to learn those things. And if you can learn the things, you can unlearn them. So it's like, okay, I get it. It's going to take some time to not believe what you've believed to be true, but you've learned them along the way, and you had to unlearn how to crawl so that you could walk. There's lots of things, you didn't know how to write, and then you learn how to write. You didn't know how to type, and then you learn how to type. There are different things that you've learned. Many of them have been helpful, how to use a knife and fork, and maybe some not so helpful. So some have been helpful and others not. And the unhelpful ones are the ones that you need to challenge. A lot of the narrative that people come to me with causes them pain, causes them suffering. And so it's how do you challenge that way of thinking?
For the self-hatred aspect of it, the thoughts that people have that are intensely negative about themselves, one of the reasons it's so difficult for people to work with is because, just like we were talking about a little bit earlier, I don't question whether or not I can speak English. I just know that I can speak English. I don't question whether or not I have, like hazel eyes. I just know that I have hazel eyes. And in much the same way, somebody goes, I don't ask whether or not I'm an awful person. I just know that I'm an awful person. I know that I'm deeply unlovable. I know that you gave a story in the book that was very touching. Somebody who was like, I know that I'm the reason that my parents divorced and that everything I touch kind of like turns to dust, essentially. Wow. That's so tied to identity at that point. And self-concept identity is like a pretty intractable part of who we are. It's a difficult thing to change. Are there things that you start doing with somebody to try to get some space around that self-belief?
So earlier on, I was trashing the kind of therapy that goes back to the origins, but now I'm going to
Yeah.
support it very,
I was
very
going to say some of
strongly.
that's actually in what you're talking about here. Yeah,
Exactly,
totally.
exactly. So there's dialectical thinking, that both of
Mm-hmm.
these ideas are true, that you can work on present moment focused issues. But the problem is that in this context, focusing on the present is just going to keep them stuck in the belief that it is true. So then you have to go back to origins, and where did the thought originate from? It's some, in the same way that you aren't speaking Italian. Well, your parents weren't Italian. You weren't exposed to Italian. You were exposed to English, which is why you speak English. You were exposed to language, ideas, concepts, interactions that created this idea that you were not enough. Who were the people? What was the context? Where did it begin to show up? Who were your teachers of self-hatred? And uh, and they are not the teachers that you need to follow. If I were to say to you, Forrest, give me somebody that you really admire in the world, and maybe say, your dad, whoever that person would be, and I
Sure.
would
Yeah.
say, yeah, your dad, okay, and then I would say, if you could, when you get to his age, be very similar in character and nature, in you know, would are there qualities about him that you would like aspire to have? You might say,
Sure.
yeah, I'd like
Mm-hmm.
to have a lot of those things. And I would just say, okay, now who is somebody who bullied you, who was mean to you, who was really cruel? And you were say, I mean, maybe you've been lucky and you haven't had those people, but maybe there was just that kid in school that,
Mm-hmm.
whatever. And I was saying, you know what? I want you to follow that person for the rest of your life as your teacher. Say, what the heck were you talking about? But that's what somebody with self-hatred is doing, is they're following the teachers that hurt them. Rather than the aspirational ones, the ones that see them for who they are, and who see the promise in them. And it's like, never get advice from somebody who's miserable and unhappy. They're teaching you how to be miserable and unhappy. And often we get advice from people who aren't that happy. And we say, but wait a second, if your advice was good, you'd be content. You'd be more serene. You'd be more at peace, but you aren't. So what advice are you giving me? You know? So it starts off with this idea that you've been taught and that you're continuing to follow um, false teachings, hurtful teachings, ones that aren't productive for you.
Yeah, for some people that learning is very explicit.
Right,
They had an abusive parent or
right,
they had an abusive circumstance. They were told over and over again that
yeah,
they are in fact a bad person and that they
exactly,
are, a screw up and so on. Much of the time for people, maybe particularly with BPD, the learning is implicit. They're having experiences that they're saying, this happened out here, so that means fill in the blank about me.
exactly, yeah, right,
And I would imagine for doing this exercise for the explicit learning, it is sort of one thing. You can go back, you can really point to it. For the
right.
implicit learning, I would imagine it's a little bit more complicated. I'm wondering what you think about that.
Sure, sure. So now you can start to do comparisons. So you can sort of say, okay, um, your romantic partner broke up with you, therefore I'm a bad person. Okay.
Sure.
Now,
Yeah.
so I would say this. Okay, now let's just imagine that they have a best friend. And I would say, have you ever had a best friend break up with you? Have you ever had a best friend who's broken up with their partner? Like almost everybody has. I say, well, you have such terrible friends. I said, what are you talking about? I have
Mm-hmm.
terrible friends. They said, because you're equating breaking up as being a terrible person. So you must have
Sure.
terrible friends. And so you can, it's a sort of a subtle form of invalidation. It's an irreverent form of
Mm.
invalidation to point out the absurdity of the thought. And now, the other thing is this: there may be some legitimate reasons for why somebody broke up with you. For example, earlier on, we were talking about those frantic efforts to avoid abandonment, the constant texting, the constant phone calls. And I would say that's the behavior that's getting in the way of the relationship, not because you're a bad person. That we can work with.
Mm.
That we can work with. We can work on reducing your reactivity. We can work on behaviors that don't serve your higher purpose. And the other, that's one approach. The other approach is if you can imagine that you, as a young child, um, struggled in a certain way, and that child could somehow think, you know, the person that I want myself to be in the future doesn't want to struggle in this way. Um, and they started to work on the areas and character aspects of their life that interfere with healthy functioning. Doing that today is taking care of a future self. You know, if
Mm.
you say, I don't want my future self to hate me, well, okay, what are the behaviors that you do in the present moment that lead you to think that you aren't worthy? So you can start working on those behaviors. Maybe I'm constantly texting someone. I tend to take things personally. Maybe I overreact to situations. Um, and that because of that, people don't necessarily like me or they don't want to get close to me. So, okay, well, let's learn the skills so that that doesn't happen. And of course, it's going to take longer for somebody who's experienced a lot of self criticism, self hatred, to heal from that than someone who's never had that experience because they won't even know what you're talking about. But, you know, these self critical lives and hateful lives are not your destiny. It's just that, that's just what's happening in your brain in the present moment because you've learned over time to hate yourself. And it's because you, um, made a cognitive error of equating uh, bad outcomes with a character flaw, when often it wasn't the case.
This is really great, in part because you're describing essentially like a process of cognitive diffusion, to put it a certain kind of way, where things are not so congealed.
Hmm.
There's not just this one sense of me and I am all of these things and I've always been these things in the past and I will always continue to be these things in the future. There's just a little bit more flexibility that we're getting around them. Something that can be difficult to talk about with this is the self preoccupation aspects that can kind of be in self hatred. There's a phrase I like, negative grandiosity, how there are so many people who think that they are unique in their badness, to put
Hmm.
it a certain kind of way. I am uniquely awful in this way. But then you ask that question of, well, has your friend had like a breakup with somebody and you still like your friend and you think they're a good person? And so what is it about you that is so unique in like
Hmm.
your negative qualities? I have to imagine though that for somebody who's already struggling with aspects of self-worth, being like, oh, by the way, no one is so special. It could be difficult to land the plane on that one. So I'm wondering how you think about it.
Well, I've sometimes run groups with people who hate themselves, and it's sort of, you get to a point where you see the absurdity of the whole thing, where you know they're all the worst people on the planet. It's almost as if there's a race to the bottom, and saying, "Well, wait a second, oh, you're worse than that one," and then or that one, and like, what are you guys trying to outdo each other in badness? And then the other thing is, often in these groups, people actually care about each other tremendously. Saying, "Wait a second, you all hate yourselves. You believe that you're unlovable, but you're each having the experience of loving everybody else in the group. So is that experience a false experience? Are you all saying the same thing, that you're not known? So how can it be true?" And then they're all trying to defend the other person from saying, "No, no, you're not such a terrible person. I'm a terrible person," but they're all saying that about themselves. The other part of it is that often, if you say, "Okay, well, look, let's just see how terrible are you. Let's take it historically terrible people. Are you as terrible as those people?" And say, "Well, no, I mean, I haven't done that kind of terrible stuff." Say, "Okay, well, what kind of terrible stuff? Are you as bad as some of contemporary politicians who do terrible things all around the world?" Say, "Well, no, I'm not so bad." I say, "Okay, are you as bad as the people who are, I don't know, stealing food from hungry children?" "Well, no, not that bad." And saying, "Okay, you're just ordinary bad. Welcome to the tribe." But it's sort of but I think I like when I run groups for people with self-hatred, because they really end up caring about each other in a deeply loving way, but they all feel that they're unlovable, so it creates a paradox. But they can say, "Can you see that you can experience loving someone even if you yourself don't feel that you're lovable, but you believe your love for somebody else to be true, and they believe their love for you to be true, just as true as you are." And that's sort of what's happening.
It's probably easy for somebody to see, whether from the inside or from the outside listening to this conversation. The suffering that's associated with being in kind of a down mood state, right? Self hatred, depression, associated suicidal thoughts. It's easy to see how managing that would be important for people and extremely painful on its own. Emotional instability doesn't just swing down; it also swings up.
Hmm.
And it can be easier to miss the importance of kind of managing the highs. It's something I was talking with a friend recently. I actually have a housemate who works as a crisis counselor, and he does mobile crisis work for the city of Santa Rosa. And so he often interacts with people who are experiencing like a manic episode or something like that. And the thing about mania is that you usually don't really mind being manic if you're in a manic episode. If anything, it might feel kind of good for you, but it still can be causing a lot of problems. So I think of your client who came in certain that that person was the love of her life, and then next week certain that the other person was the love of her life. It's a little difficult to ask kind of an open-ended question about that, but essentially, what do you think about that? Are there things that can help people who are even in that more high state realize, no, this is also a risk factor, to put it a certain kind of way. The roller coaster goes up, sure, but that means it's going to come down.
Well, before I answer that, I just want to give a shout out to your housemate. Thank you
Mm-hmm.
for doing
Yeah,
that work.
it's hard stuff. Yeah,
Unfortunately, not the vast majority of people who need mental health services aren't getting them, and having people who can be out and helping them are just remarkable people. So
yeah.
kudos to your housemate. The fire that burns your house down is also the fire that cooks your food. You can't tell the difference between the fires. It's just like the context and emotions. I mean, emotions. There's nothing wrong with emotions. It's just like when they're inflamed and out of control, and that as a human being you can co-regulate. So we can certainly flame the fires when somebody's dysregulated, meaning that their emotions aren't in control. We can argue with them, we can fight with them, we can cause them to have panic attacks and stuff like that by our own dysregulation. But when we take a breath, when we calm down, when we relax our bodies, it sends um, emotional messages to the other person's brain that things aren't as bad as as they appear to be in that moment. Now, of course, if somebody is manic or if somebody's psychotic, they might need medication to treat those kinds of states. And even if the person doesn't want to get treated because they feel good or they're suspicious of what you're trying to do, it's possible that they need medication. But for conditions like borderline personality disorder, having a reassuring, soothing, thoughtful, reflective, non-combative, and validating other person in your life can lead to a lot of emotion regulation and co-regulation. So you can co-dysregulate and you can co-regulate.
You were just talking about medication for a moment there. You're a psychiatrist, part of your training. For BPD, I've heard very mixed things about medication.
For core BPD, there is not a single medication that can help for core BPD. So medication isn't going to heal your abandonment fears. They're not going to heal the intensity of your relationships. They're not going to give you a better sense of who you are. Now, having said that, many of the people who come to my program are on multiple medications, and that is because borderline personality disorder often occurs with other conditions like depression, like anxiety, like mood disorders, like substance use disorders. So that co-occurrence is also called comorbidity. So BPD is often comorbid or co-occurring with many other conditions. And for those, there are medications that you can use. But for core BPD, there isn't a medication that can help.
One of the things also to just open a couple of cans of worms at the end of this episode, because why not? BPD is a heavily stigmatized condition among people in general. It's also stigmatized among clinicians. I've had multiple friends now go through graduate programs to become therapists, and there's a lot of advice kind of floating around out there about seeing BPD clients. It could be very draining. Maybe think long before you do that. It becomes very tough for people to access services at a certain point if this is part of the story that we're telling people who are working in the field.
I don't necessarily think about these things, but I was at a reunion with a lot of colleagues, former medical school colleagues, and they all wanted to know what everybody did. And I said I've dedicated my life to working with people with borderline personality disorder. And I was saying, dude, you look all right. 61 years old, you look all right for somebody who's
Everyone's like, whoa, why would you? Yeah, this is what I'm talking about. Totally.
They look maybe less healthy or something like that. And they say, I said, why should I look any different? They said, listening to all those people complaining about suicide and everything. And I said, who listens? No, I didn't say that. But it's because through the practice of mindfulness, when you have incredible successes in your clinical practice, when you see people transcend their suffering, become therapists, become physicians, become engineers, become lawyers, because they now have the skill set. They're often people with tremendous promise. It's just that they don't have the deficit. If I started to yell at you, going back to our previous analogy and saying, Forrest, you're just like this terrible human being because you don't know how to speak Greek. And then you were saying like, wow, like he's just like this terrible human being, rather than having compassion for you and understanding that you never learned or, never learned well, or you might have a learning disability or something that didn't allow you to learn something. But what we do is we penalize people for the symptoms that bring them into therapy. If somebody had asthma and they came into the clinic wheezing, that would be understandable. You wouldn't say to them, stop wheezing and then come back. If somebody's dysregulated, that's a manifestation of the disorder. It's like that's the thing that they need help with, and that's the thing that they're asking for help with. It's not that they wake up some morning and decide, I'm going to piss you off. No one wants to do that. They're already suffering as it is. That's not their intention. And it's not an intention of a parent to have a child with borderline personality disorder. It's just that there's a mismatch in terms of what a child needs and what a parent has the capabilities of of of, of showing them. And I think just showing compassion to anybody who's suffering. I was told that our system wouldn't work because we would have fights all the time and we would have, people getting restrained all the
I'm
time.
sure
We've
there
been
was a
open
lot of skepticism. Yeah.
a lot of skepticism in 18 years. I mean, if we've had 5 restraints, that's a lot. By the way, I don't have a quiet room. No one goes into the quiet room. My doors are open. People can leave. I don't lock people up. But these are people with severe borderline personality disorder. They're not getting into fights. They're not getting restrained. They're not getting locked up. But we've had, as I say, nearly 5,500 people come through us. It's not the thing that's happening. When you treat someone with compassion and kindness and care for the thing that they're struggling with, they tend to do better. Just saying.
We just have to improve how we talk about this stuff. And if you treat something like it's going to explode in your hands when you touch it, what does that do to the thing?
Exactly.
Like, does that make the thing feel better about itself? Does that
Exactly.
make the thing more likely to explode or less likely to explode? Like, I don't know. You tell me, but my experience, way more likely to explode.
Of course.
One other can of worms at the end. As we've been having this conversation, I have been noticing a lot, at least in my mind, of overlap between borderline personality disorder and complex PTSD.
Mm-hmm.
Different variations of similar patterns, shame and self-hatred as a core feature, attachment dysregulation, all of that. Given some of the commonalities to me, it's interesting that I've talked to a lot of people who do work related to complex PTSD, people who have complex PTSD. I've basically never heard somebody recommend DBT for complex PTSD. It's typically more trauma-focused therapies.
First of all, a person can have complex PTSD, a person can have BPD, a person can have complex PTSD and BPD.
Yeah.
In BPD, there typically isn't a traumatic event. Either there might be invalidation, but often, many of the parents that we see are just loving parents, and the child is just an extremely sensitive person that's experienced invalidation over their life and hasn't learned how to regulate their emotions. With complex PTSD, there's always a trauma. And often in BPD, you see the symptoms of BPD, like self injury, like emotional dysregulation. Often for complex PTSD, the symptoms of BPD are often used to regulate the emotion. So if somebody is dysregulated with BPD, and then they cut themselves, for example, then that might just be BPD. Someone with complex PTSD, they might be having flashbacks and they're using self-injury as a way of regulating. For BPD, people are often somewhat gregarious and they're like out there and they're like wanting to meet people, especially when they're regulated. For people with complex PTSD, there tends to be an avoidance of situations. There's more of that kind of a sort of a trauma response. And DBT is very, very good for emotional dysregulation in conditions like borderline personality disorder. But if somebody came to me and it was clear that they had complex PTSD, they had an otherwise relatively stable sense of who they are. Whereas in BPD, people often don't have a stable sense of who they are. I would be recommending a trauma-focused therapy, such as what the one that we use in my program is more of a prolonged exposure type of therapy, but there's trauma-focused cognitive behavioral therapy, narrative therapies, and something else. But I would be recommending, some kind of trauma therapy. Now, what happened is that because a lot of trauma therapists will not work with somebody who is self-injuring, if self-injury is being used as a way of regulating the trauma experience, then where's that patient going to get help? if no one is taking them. So then typically the DBT therapist is willing to take a self-injuring client. They will teach them the kinds of regulation skills that will help them reduce their self-injury or eliminate it altogether, and then they can do the more focused trauma therapy.
With complex PTSD, early childhood experiences often are a huge part of it. Not always, but often are a huge part of it. With BPD, you were talking about a number of cases, many of which you work with, where parents are supportive, school environment is supportive, the person just has an underlying sensitivity that makes those normal painful experiences that we have land on them particularly harshly. That suggests to me that it's a little bit more nature in nature as opposed to having as much of a nurture aspect. How do you think about that?
60% of BPD is genetic.
Which I assume we know from twin studies and the like are
Exactly.
similar.
Yeah.
Yeah,
The twin studies. Yeah.
makes total sense. Is there anything that as we get to the end here, Dr. Blaise, you just want to kind of leave people with, particularly people who are experiencing more of the self-criticism and self-hatred that you've focused on over time?
I think that people who've struggled in these ways are some of the most incredible human beings I've ever met. And the reason I say that is because they've had time to reflect on their lives. And it's sad that bad things have had to happen to them to make them more introspective. But nevertheless, they're more interesting, they're more introspective, they're more engaging, they're more fun to talk with. They have a lot of um, dialectical thinking. The sadness to me is that they continue to believe these negative thoughts about themselves. And if you're listening, you are so worthy. You're so worthy. Your brain's tricked you into believing that you're not, and that's just a fault of the brain. And you can overcome that, but it's just not true. It's just like one of those faulty learnings. And once you see how essential and how incredible you are, um, the world's your oyster, your clamshell, it's something, but it's something other than whatever negative picture you've painted of it.
Dr. Blaise, thanks so much for doing this with me today. This has been really fantastic. I've learned a lot from this.
Thank you so much for having me on your show, and I really appreciate the questions and the deep insights.
Yeah.
And not only do I want to give kudos to your housemate, but also to your dad, who obviously raised an incredible human being.
Thank you so much. I really appreciate that. That's really kind. I had a great time talking today with Dr. Blaise Aguirre about DBT and borderline personality disorder. Dr. Blaise is an incredible expert in this space. He's helped around 5,500 patients at McLean Hospital, many of them through the specific program that he runs there. He's had an incredible level of success working with those people. The outcomes have been fantastic coming out of that program. And so the way that he is approaching this clearly is doing something for people. So, one way to understand borderline personality disorder is as a difficult combination of a fast car, a lot of emotional intensity, with weak brakes, a lack of regulatory skills. And something that Dr. Blaise emphasized over and over again throughout the conversation is weak skills or a lack of regulatory skills or any language we put on it can sound a little negative and invalidating for somebody. Most of the time, 9 times out of 10, if not 99 times out of 100, it is not somebody's fault that they don't have a particular skill. They didn't learn that skill. I didn't learn Greek when I was growing up, so I don't speak Greek. So I can go back and analyze why I don't speak Greek in adulthood, but that's not going to actually teach me how to speak Greek. And that's why an approach like DBT, which is very skills based, can kind of come into the equation here for people. Some of the common aspects of BPD are a combination of abandonment fears, a lot of reassurance seeking related to those abandonment fears that unfortunately can push people away. Cycles of idealization and devaluation. We didn't actually use that language during the conversation, but that's how it's typically referred to. Really high highs, really low lows, and quite a bit of pendulation back and forth inside of relationships from idealizing the person to devaluing them. So, if somebody with BPD is working with a clinician, they might initially be in a cycle where there's a lot of idealization, then something happens inside of the relationship that leads to a lot more negative thinking about the person that they're working with. And hopefully, in a good therapeutic process, that then becomes a kind of target for intervention. And it becomes a way to talk about this pattern as a whole. Something we didn't get into as much in this conversation was suicidality, but it is also a major feature of borderline personality disorder, in part due to the self hatred that often accompanies BPD, which is based on a very complicated combination of things. Some of it is about the messages that we receive from the environment that are more implicit in nature. Sometimes it's about the more explicit messages, somebody saying you are a bad person. I think a big piece of it is the stigmatization of BPD in general, which we talked about a little bit during the conversation. BPD gets an incredibly bad rap in part because the challenges that are associated with it often show up for people socially. So at the point that somebody goes, "Hey, I have BPD," and they're reading all of this stuff or hearing all of this awful stuff about people with BPD, it's very easy for that to exacerbate that kind of self hatred or self criticism. One of the things that I thought was interesting in the conversation was when we turned to talking about self hatred more explicitly, how Dr. Blaise moved from his kind of general DBT skills focus to much more of that history-driven narrative forming. Who told you this story? Who is the person who taught you that you should hate yourself, that you were such a horrible person? Where does that narrative come from? That became a much bigger part of how he approached thinking about it. One of the major difficulties here is that self-hatred is very fused to identity. You don't ask yourself whether or not you speak English or you speak Greek. You just know that you speak English if you're a native English speaker. In much the same way, I don't ask myself if I have hazel eyes. I just have hazel eyes. Somebody who is mired in self hatred does not ask themselves whether or not they are a good person. They know that they are not a good person. And so it can be very difficult to start to get some space around that belief. And Dr. Blaise talked about a number of ways that he approaches doing that during the conversation. DBT is an approach to therapy that teaches 4 main groups of skills. The first are mindfulness skills, the second, emotional regulation skills, third, distress tolerance, and then fourth, various kinds of relationship skills and interpersonal effectiveness skills. Many of those skills are dialectical in nature. That's where DBT, the name of it, comes from. And this means integrating 2 different things as one coherent whole. Acceptance and change from acceptance and commitment therapy would be an example of this. These things feel like opposites, but they actually work together very effectively. Dr. Blaise even kind of made a joke about it during the conversation when I pointed to the fact that, oh, now we're doing the history making part as opposed to being so skills focused. He was like, well, yeah, there it is right there. That's a dialectic, right? I'm emphasizing skills by and large in my work, but then we have this part that is also true where we do have to go back and develop a sense of history. What was it about your relationships, or what was it about what was going on for you earlier in your life that led to you feeling this kind of way about yourself? One example of this that we didn't talk about during the conversation, but it's a big part of DBT, and I think that it was kind of alluded to essentially by Dr. Blaise, is what's called wise mind. And this is bringing together your emotional mind with your more rational mind. And I think that one way that Dr. Blaise talked about this was when he was doing a lot of very authentic validating of the emotional intensity that can come for somebody who is maybe full-on diagnosed BPD, or even just has a kind of BPD-ishness. Maybe you don't hit diagnostic criteria, but you've got some of this emotional intensity and associated difficulties regulating it. There's a lot of value to being a person who can feel things strongly. There is, and I want to really emphasize that, that is a beautiful thing, to be able to really feel your feelings in an intense and lived way. There can be moments of that and aspects of that that are just so incredibly satisfying. And I speak to some extent as somebody who has a tiny grain of familiarity with this. I would describe myself, as I did during the episode and have on the podcast in the past, as a relatively sensitive person. And man, when you are sensitive and it's feeling good, it is feeling so good, man. And it is difficult to put into words how great that experience can be. But you have to balance that with all of the other stuff, the rationality, seeing the situation clearly, making good choices, understanding, okay, I've gotten a little high right now, and I want to be thoughtful about kind of letting myself down gently, or whatever it is that I need to do to apply a little bit of brake to this car. And this is all landing in a broader context for people where we live in a culture, and I wish we had talked about this even a little bit more, where people are taught to be dissatisfied with themselves, in part so they keep on buying stuff. There is a capitalistic aspect to this whole thing that we didn't get into. But, you're constantly marketed to on the grounds of you don't look the way you should look. You're not actually as good at that thing as you should be at that thing. There's something about you, it's not so good. But if you buy my whatever, then hey, you'll feel better about yourself and you'll look better and you'll be nicer and you'll be more successful. And, we're just going to keep on kind of selling this and pushing satisfaction as a target down the road. We're constantly moving the goalposts on allowing people to feel good about themselves. Dr. Blaise talked about it at the very beginning of the conversation when he mentioned young people feeling less successful these days, in part because, the economy and hiring out of college going down and AI and all of these very complicated social and economic factors that could very understandably lead to somebody feeling not so good. And this gets to a inherent unfairness about this whole thing, because if you're somebody like me, who's got a pretty, for lack of a better way of putting it, a pretty friendly brain. My brain is pretty calm by its nature. It's pretty well regulated by its nature. I don't have to work too hard to develop those kinds of regulatory skills. I don't have to work too hard to exist in the culture that we all exist in. It's an okay fit for me. But if you're somebody where it's just not such a good fit for you, you got to do a lot more work on a day-to-day basis just to have the trains run on time, let alone to feel successful and accomplished and like your life is worth living. And that's why these challenges are so real for people, because there's bad fit. They have a sensitivity, sure, but man, they are landing in an environment that is not supportive of any degree of sensitivity, let alone a high degree of sensitivity. And I think maybe to loop back to the beginning a little bit here, that's why we get this so wrong with the stigmatization of BPD in particular, and whatever we call mental illness, in heavy quotation marks in general. Because a lot of the time what we're describing that way is just normal variation in people. Normal sensitivity, normal inattentiveness, normal interest in what's over the next hill, to talk about some more ADHD symptomology, normal desire to not be abandoned by other people. These are all normal things. When the volume is cranked up on them is when we start to bump into some challenges, sure. And then we got to be really good at teaching the skills and supporting people through those experiences. I loved the note that Dr. Blaise ended on, talking about essentially just how much he loves his clients and loves working with his clients, and how these are just some of the most thoughtful, emotionally engaged, introspective, beautiful, eventually extremely successful people that he's ever interacted with. And I just think that that's the perfect note to close today's episode on. So if you made it this far, thanks again for listening to Being Well. We really appreciate it. If you are watching on YouTube, you can give it a thumbs up, hit the subscribe button. If you are listening on Spotify or Apple or hey, somewhere else, you can subscribe on that platform. You can leave hopefully a positive review, a comment, really helps us out. We totally appreciate it. If you would like to support the show in other ways, you can find us on Patreon. It's patreon.com/beingwellpodcast. And for just a couple of dollars a month, you can support the show and get a bunch of bonuses in return. Until next time, thanks for listening, and I'll talk to you soon.